Hey, how's it going?
Good. My name is Andrea. I'm a student nurse. Is it okay if I shadow you today?
Yeah, no problem.
Great. Would you mind giving me an S-bar on your patient?
Sure. So right now my patient is Mrs. Marta Yorn, and she's in room 529. She's 80 years old, and she's a female. She's full code, and she has no known allergies. Her doctor is Stephen Jolly, and Marta is 175 pounds. She's 5'5", and her BMI is 29.1. She's NPO after midnight, and otherwise she's a regular general diet. Her primary diagnosis is a non-healing sacral ulcer, and she has had multiple admissions recently for dehydrations and pneumonia. And she denies smoking. She has no history of heart disease. She had a motor sensory examination of her upper extremities, and she had normal reflexes, and is symmetric and bilateral. She is slightly hard of hearing and occasionally has watery eyes. She has no complaints of headaches or change in vision, nasal problems, or sore throat. She denies numbness beyond the sacral area where she has her ulcer. She's learn-oriented ×4, and she has 20/40 vision. She's had multiple admissions for community-acquired pneumonia recently, and she was last admitted for that 6 months ago. She has symmetric chest expansion, clear auscultation in all lobes when she came in this time, and the anterior and posterior diminished in bases. She denies chest pain, the palpitations, or shortness of breath, no syncope or pre-syncope episodes, and she has not a normal sinus rhythm with occasional premature beats. Like I said, her diet is NPO after midnight, otherwise it's regular. She reports decrease in appetite. She takes Sinucide, PRN for constipation. She's on acetaminophen for pain. She denies nausea, vomiting, no changes in her stool pattern or consistency or odor. She complains of stress occasionally, stress incontinence with nocturia, bowel sounds present ×4, soft abdomen. We've been taking her intake and output recently, and her intake was 850 milliliters, her output 350 milliliters, and she consumed 50% of her dinner. For her stage 3 pressure ulcer, it's on the sacrum, it's full thickness tissue loss, subcutaneous, fat, maybe a little visible. No success with her outpatient treatment. It's been around for 3 months, so it's sticking around. She has dry, scaly skin around the area, has some serious exudate, and no unusual odor with that. Right now, we're cleaning the sacral area with saline, cover it with a hydrocolloid dressing. Her last vitals is taken at 14:15, and it's 99.1 degrees Fahrenheit, and heart rate is 88, oxygen saturation is 92, respiration is 24, and her blood pressure is 144/90. Let's see here. We're going to be giving her an antibiotic, the gentamicin, and also she has a continuous fluids of sodium chloride with potassium chloride. And her hemoglobin is 12.1, hematocrit is 37. Her white blood cell count is 12,500, so it's a little high. Her red blood cell count is 4.6, slightly low. Albumin's low, 3.2. And her Bond's high, 22. Her urine analysis is a clear amber color. Yeah.
Why specifically is the patient receiving this medication, and what action does this medication have on the body?
So Marta, she has her pressure ulcer, and she has signs of infection. So we're giving her the gentamicin aminoglycoside to fight the infection. It acts as like a bactericidal action, and it inhibits protein synthesis for the bacteria. So it fights off gram-negative bacteria and streptococci type bacteria.
When should you question administering this medication?
If she has any history of adverse reactions or hypersensitivities to the aminoglycosides. And also if she has kidney problems, you don't want to question giving it to her then. And you don't want to look at her her concentration to make sure it's not too high so she could have nephrotoxicity, things like that. Also some neuromuscular diseases be a contraindication.
Does this medication have a therapeutic serum level, and which vital signs must be monitored?
Yeah, I believe it's 12 to 15 micrograms per milliliter, and this would be the therapeutic level. And if it goes over that, they could be have nephrotoxicity. You want to check all vital signs, but you don't want to check the cultures and labs. Make sure those are in before you administer the antibiotic, and just to make sure that there is signs of infection, so she's not getting the antibiotic for no reason, because that could just make the virus stronger if it's not that, things like that, or the bacteria, excuse me. And so you want to check that. You want to check the wound area to make sure, like, the signs recorded, the signs of the infection, how it looks, to compare with it after the treatment.
Which physiological parameters should be monitored when you're giving this medication?
Just look at her cultures and her lab values continually. You want to look at her vital signs and take a look at just the wound area, and check her potassium levels before giving it, because the sodium chloride is with potassium, so you don't want to make sure she's not becoming hyperkalemic. You don't want to, like I said, check her levels of the antibiotic to make sure it's not going to be toxic to her kidneys. And
What interventions must be taught to the patient to ensure that this medication is being administered safely in the hospital setting?
Well, you want to follow standard procedure for setting up an IV. You want to have clean hands, wear gloves, connect it properly, make sure there's no bubbles in the lines. You want to cap all the ports. You want to also wipe them down with alcohol before connecting flushes and different connections. You don't want to check the bag for expiration, for cloudiness, for tears. You don't want to let them know about the signs of possible things that can go wrong with an IV, such as infiltration, phlebitis, or have an embolism, and have them know what to look for to see if that's going to happen. Also, just never share your medication with anybody. Yep.
How about interventions for taking this medication safely at home?
It's going to be pretty much the same precaution, but just they're going to have more responsibility, so you want to make sure they know everything to watch out for and know how to do the standard procedures, or just to make sure that our home care nurse can do the same way as I would do it in the hospital.
What are the side effects and potential adverse reactions?
Be ataxia, be like vertigo, like dizziness, also the nephrotoxicity and the otoxicity, and also just adverse reactions, like allergic reactions to it.
How will you know if this medication is effective?
You don't want to check the serum levels to make sure it's in the therapeutic range, and also just keep checking on the different cultures of the wound and the lab values, and just examine the wound to make sure it's not getting worse, if the exudate's getting more of a foul smell, things like that.
Thank you.
Yeah, you're welcome. So, want to go with me to give medication to my patient?
Yeah, that'd be great.
Cool. So I have Marta pulled up now. First thing we want to do is we want to check in the chart to see if she has any known allergies. And nope, no known allergies. So I'm going to wash my hands before coming in the door. I'm going to give her a little knock to let her know I'm coming in. Hello.
Hi.
Hi, I'm Joe. I'm going to be giving you your antibiotic.
Okay, cool.
Yeah. And what is your name?
Marta Yarn,
Okay, and what is your age?
80.
Years old. Okay, thank you, Marta. So we're going to want to come back here and check in the chart, and it's the right patient. And yeah, looks like today we're going to have her get her garamycin, it's the gentamicin, and the dosage time would be 1600, and it's 1506, but it'd be okay for me to give it now because with an hour leeway. And also, I'm going to hook up her, she has a continuous infusion of sodium chloride with potassium, and it's 20 milliequivalents of potassium per the 1,000 milliliters. And that's continuous. That's going to rate 125 milliliters an hour. And the gentamicin is going at 80 milligrams per 100 milliliters and in over 1 hour. Okay? And I'm going to check the MAR and compare it to the doctor's orders, make sure the dosage and the medicine's correct, and also the time. And all this is going to be intravenously hooked up and to the right patient. Okay. So then I want to pull out my normal saline with the potassium, the gentamicin. Here. Also, we'll be using a dial flow to control it since we don't have a pump. And you got our tubings. And a flush. Okay. So I'm going to put some gloves on. Powdery. So how are you doing today, Marta?
I'm doing great. How about yourself?
I'm doing wonderful. Did you have a nice lunch?
Very yummy, yeah.
Yeah. And you know why you're having the antibiotic, right?
Yeah, I have an infection.
Mm-hmm. Yep. Alrighty, so I'm going to pull these up. I want to take a look, compare them. So it's going to be sodium chloride, the normal sodium chloride, 0.9% with potassium chloride, 20 milliequivalents per 1,000 milliliters. Compare that. Yep, and it's continuous and the same. It's be continuous, so it's you don't have to check the time. It can be any time. The dosage is correct. The medication is correct. It's Marta Yarn. That's who it's prescribed to. And the route it's going to be intravenously. And for this, the gentamicin, it's going to be gentamicin, and as you see here below, it's going to be 80 milligrams per 100 milliliters, and over 1 hour, it's going to be subcutaneously, and not subcutaneous, intravenously. It's going to be at Tuesday, 1600, and that's the correct time, the right dose, their medication that's also prescribed already. Okay. So I'm going to take my scanner. Or I'm just going to scan your bracelet. Okay. Beep. Thank you. And could you tell me the ID on your wristband, please?
716 2893.
Is there another?
Yeah. 594 09 05 652.
Okay. And then also the type in the sodium chloride. Alright. And I have the green light. So I'm going to put this up. Okay, I'll be leaving this in the package until I flush flushing Mario's IV site. Did I see your IV site, Smart? Yeah, I don't know why this might have been keyed for one time. Because I have all the claims on it.
Yeah, I've seen a lot of people do it. I don't know if
Sometimes I see nurses flick the tubing, Mr. Joe. Would that help?
Yeah, I'll try flicking it. This is strange.
Is this one? That one's open.
Yeah, everything's open. It just, I don't know if it's because there's so many like water bubbles stuck in there from when I emptied it out before.
I just used the different tubing. Or what?
Is there a tubing that's...
You can use mine in the back corner. Oh,
I feel like it might be the same problem though.
I'm patient. I don't have much to do right now.
You're being a very patient patient.
Well, thank you. Thank you.
You're welcome.
See if this has any different effect. Oh, and before I administer to the patient, could you just verify that this is the correct medication speaking of earlier?
Yes, that is normal saline with potassium chloride.
Exactly.
Good thing it's just, a normal one. Antibiotics will be.
Okay, everything's open. Oh, no, movement. It's priming. Wonderful. So I'm going to go through and check for air bubbles. Clear of all air bubbles. So now I want to get the dial flow, set the correct infusion rate. And once again, I'm going to double check the infusion rate. So the normal saline's going at 125 milliliters an hour. So you just twist the dial flow, 125 milliliters an hour. And I want to take an alcohol pad and wipe down just to make sure that everything's clean on both ends. And then we're going to connect it. 125 milliliters an hour. Do you confirm that? See what's on the dial clock?
Yep, 125.
Alrighty. Now I'd connect that to my patient, Marta. Having flushed her site, make sure it's patent. And then just let it flow. Alrighty. So now let's get you hooked up. Now we have it on your continuous infusion. Let's get you hooked up to your antibiotic.
Alright.
So I'm just going to scan your bracelet once again and ask you for the code. Beep. Alright, and what is your ID?
594-0905-62-652.
Sorry, what, 652?
Yeah.
Alright. And once again, this is the gentamicin antibiotic. It's going at 80 milligrams, 100 milliliters. It's given intravenously at 1600, which is the right time. And it's for Marta, our patient. And can you confirm that it's the right medicine, right dose?
Yep, gentamicin.
Mm-hmm. And also, I called the pharmacist earlier and I double checked, and like I thought, you have to use the gentamicin with the normal saline potassium, and there's no interactions between those, and you want to combine those two for the infusion. It's fine. All right, so I just enter in. Yep, now the green light, so it's verified. So we want to lower the normal saline. Take out the tubing. Make sure it's locked. Once again, I want to make sure all the ports are clean. If they're left open, make sure they've been capped, and make sure all the ports are clean before I connect them. First of all, make sure I prime it. So I'm not going to the tapes in. It's primed. Checked it. No air bubbles. So now I want to connect it to the dial flow. For release it, I want to set the right speed. So I'm just going to double check that one more time before. and that's going to be 100 milliliters an hour. So we're going to crank it down to 100 milliliters an hour. And then once again, I want to make sure Mara's IV site is open. So I'll take the flush order. Thank you. Make sure everything's clean. I'm gonna get up. And then I'm gonna release it. Can you hold this for a moment? Okay, thank you. So remove gloves. Wash my hands. Marta, are you in any pain right now?
Nope.
Okay,
Feeling great.
awesome. Well, thank you for being such a patient.
You're welcome.
And oh, before you leave, I want to talk to you about a few things, give you a little teaching. So, for your antibiotic that you're running, you probably don't want any exposure to the sun because it might give you a sunburn, things like that.
Okay.
You're going to want to check out your. I know it's hard to see your sacral ulcer because it's in the back, but if you look in the mirror or if you just smell anything like a foul smell coming from it, it'd be better to let one of the healthcare professionals know about it. And if you're at home, things like that. If you're able to look into a mirror, look for signs of infection like redness and different colors of exudate you see coming out, some like funky colors. We want to make sure you don't share your IV fluids with anybody else, and just know some side effects. If you get dizzy on it, if you have problems with your eyesight, want to let us know. And just keep an eye out for all those things. If you're for IV site, if you start having swelling or if it turns red and painful, also be a thing to let us know so we can help you out with that.
Okay, thank you.
Yep, thank you.
Were there any pertinent pieces of information you reviewed before administering the patient this medication?
Yeah, I just want to check the serum levels of the medication to make sure she's not having like nephrotoxicity if the levels are too high, if they keep building up within her. Also check her vital signs, make sure all the labs are in for labs and cultures are in before I give her the antibiotic because that could foul up the results of it. You want to take a look at the wounds, and also I checked her potassium levels just to make sure that it's not too high because there's potassium in the normal saline she's receiving.
Did this information affect your decision to administer the medication?
Yes, because that let me know that this would be therapeutic for Marta to receive the antibiotic, and that there'd be no indications for her not to receive it.
Did this information affect how you administered the medication?
No, because I would still follow standard procedures to administer the medication intravenously.
Thank you.
Thank you.